All right. Hello, everybody. Welcome to today's PBIC webinar. We're excited to have you all joining us today for a really important discussion. We're actually going to be kicking off a two-part series of webinars today, all about creating age-friendly streets. Our panelists that we've assembled from a variety of organizations are going to be talking with us today and then next Monday when we continue the series, sharing information about mobility and safety challenges and opportunities for older adults. We're going to be focusing some attention on strategies that can help us improve our transportation system for our aging population. This is a really critical issue of importance, I'm sure, in all of your communities, and we're excited to shed some light on it for you and have you all join us in this discussion over the next couple of weeks. So we're excited to have such a great panel with us today. My name is Dan Jeline. I'm here at the Pedestrian and Bicycle Information Center, and I wanted to take a moment to just introduce you to the panelists that we have joining us today. First, we have Bill Armbruster, who's a senior advisor with AARP's Livable Communities team. Bill manages the AARP network of age-friendly states and communities, a program within AARP Livable Communities. He's been with AARP since the year 2000, joining as Associate State Director in New York, serving the upstate and western region of that state, and was responsible for the development, implementation, and assessment for community outreach and programming there in New York. So we're excited to have Bill with us today. Laurie Beck is also joining us. Laurie is an epidemiologist in the CDC's Injury Center's Transportation Safety Team. She's worked on transportation safety for more than 15 years, and her research interests include older adult mobility and seatbelt use. She conducts research and surveillance and provides technical assistance on grants and contracts. So we're excited to have Laurie with us as well. We're also joined by Dr. Timothy Platts-Mills, who is Vice Chair of Research in the Department of Emergency Medicine here at the University of North Carolina, with a joint appointment with the Department of Medicine's Division of Geriatrics. Dr. Platts-Mills' research is supported by the NIH, the NIJ, and the West Health Institute, and covers a range of subjects related to the emergency care of older adults, including the effect of acute injury on long-term outcomes. We're grateful and thrilled to have all of our panelists with us today, and we're excited to have you all here in the audience bringing a lot of your own expertise and perspectives on this issue. I just wanted to take a moment or two to cover a few housekeeping items. For you as attendees, you won't have the ability to speak during the webinar today. You will have the opportunity to send us questions and comments along the way using the questions pod in the GoToWebinar control panel. So you can send those to me at any time. I'll be monitoring the questions pod and compiling a list of questions that we can use for our discussion period, which we're going to be holding for about the last 30 minutes or so we can ask our panelists to weigh in on some of those questions that you're wondering about. So I'd encourage you to please send those in as soon as you have them ready. As soon as you've got those questions in your mind, please send them over to us, and we'll be compiling those along the way. We are going to be posting some archive material from this webinar. So our archive page from pedbikeinfo.org/webinars, that's where you can find it. It's going to have a couple of different resources being added to it over the next day or so. So one of those will be a copy of our slide presentation available as a PDF file, so you can refer back to the slides that are shared today from our panelists. We know you probably want to take notes and all that, and we hope that the slide archive will help you remember some of the material that was covered. So that will be posted soon at pedbikeinfo.org/webinars. We also will be recording the webinar today and plan to post a video of the recording on that same page. So we'll put that material there so you can find it after the fact. If you want to share the information with your colleagues, we encourage you to visit that page to do that. You'll be getting an email from me later today that'll have a few pieces of information. One, the archive material will be there. The second will be some information and instructions for generating a certificate of attendance for yourself and possibly your colleagues who are joining with you. So if you're the one who registered for the webinar, please take that email and pass it around to those who are joining with you so that they can also generate their own certificates of attendance. We've also submitted this webinar to the AICP to be approved and was approved for 1.5 CM credits. So if you're a planner and you're used to claiming those, you can do so at the AICP event calendar website. The rest of you all hopefully can use the certificate of attendance, which will show 1.5 hours of instruction completed to self-report those PDHs and continuing education requirements that you need to report. PBIC is offering a number of webinars. I'll tell you about a couple of the upcoming sessions in just a second, but to stay up to date with us, you can visit pedbicinfo.org/webinars. We're on social media as well. We typically talk about our webinars there, and we send out emails to our listserv, our email listserv, every time we schedule a new one. So that's the best way probably to stay up to date with what we're working on. I mentioned that this is part of a two-part series, and so I want to encourage you to also sign up for part 2, which is going to be next Monday, starting an hour later, 2 p.m. Eastern Time. We're going to hear from, again, panelists from AARP and someone from the city of San Francisco who will be talking all about strategies that we can use to change our built environment in a way that really supports the mobility needs of older adults and helps keep them safe while walking and while bicycling. So we'll continue that series next week. And then next Thursday, we have a webinar with some additional panelists from CDC and a person from the city of Raleigh who are going to talk all about how we can make everyday destinations connected with active transportation modes, so bicycling and walking to complete everyday trips. So we'll talk about that next week. So those are a couple of sessions we have coming up. I hope you'll consider signing up for those. I have a quick poll that I want to send out to everyone just to ask about how many people are attending the webinar today. We'll keep this poll open for just a few minutes, and then we'll continue on with the webinar. All right, just a few more seconds for the poll, and then we'll continue on with our presentations today. All right, I'm going to go ahead and close that down. Thank you all very much for participating in that. I am going to send the screen over. Let's try this again, Bill, and see if we can't get this slide to go with us here. I'm going to send you the screen, and hopefully we can get rolling with our material here. Okay. So I've got your desktop now, Bill.
Can you see it?
Can you pull up? I don't see PowerPoint yet. I just see your desktop, the AARP logo.
All right, let me try that again.
Yeah. And you may even try, we could try to pull, if you want to pull up that PDF version of it, it may be another way to show it. Here.
How about now?
It's working. It's coming through, I think.
See some red bikes? Are we good to go?
I see that that notes version again, Bill, and I wonder if you see that top bar where it says display settings. Does it show you that? Okay.
Oh, hang on. Well, maybe we'll have to do it with a notes version. Is that all right?
That'll be all right, Bill.
People just get a preview. Welcome, everyone. Sorry for the momentary delay. My name is Bill Armbruster. I'm a senior advisor at ARP in our Livable Communities Department, and I manage the ARP network of age-friendly states and communities. As of today, we have 260 communities enrolled, or 360 communities enrolled in the network. And as of tomorrow, we'll have 4 states enrolled. And I think this is really timely talking about age-friendly streets, because we talk about communities and what it takes for a community to become age-friendly. And part of that is looking at the different domains of livability. We talk about things like the built environment, looking at housing, transportation, mobility management, outdoor spaces, parks, but then also looking at other aspects, looking at work, looking at volunteerism, looking at community supports and programs that may be in the community, as well as social inclusion, making sure that people are respected and acknowledged in their community. So as we think about transportation planning, as we think about developing our streets, I think we really need to have a big understanding of who lives on our community and how they want to engage in their community. Years ago, we used to talk about aging in place. And to me, that always meant we would put someone in a seat and we would bring them all the services they want. And what we know now is people want to age in community. And as we think about our communities, who are we designing for? Are we designing for that, 35-year-old with a family, or are we breaking up our community into all different life segments and abilities so we really have that concept of who we're designing for? So I want to just run through some stats quickly. Transportation is key. This is what connects people to their community, whether it's active transportation, whether it's vehicular, whether it's, supportive transportation that gets people out. But these are the things that connect people to their community and their community back to them. And what do we want to think about is really, can people get out safely? We look at, a death every 15 minutes in America, trip to the emergency room every 12.6 seconds. And in the time it takes to read that sentence, 2 more car crashes occurred on Americans' roads and streets. So even though we're working on doing this better, I think we have a long way to go. How do we continue to reduce these numbers? Because when you look at people who may have a disability or people who may be getting older or maybe more frail, we also have this issue of how comfortable do people feel when they're getting out. So are we designing roads that are by nature starting to isolate people because they don't feel safe getting out, either walking or biking? And here's just some more stats. 46,000 people struck and killed by cars, within a 9-year period of time. 13 people struck and killed by a car walking every day. And this is important. As you get older, you're more likely to be killed during a car crash with someone who is walking than you are if you are younger. So that's something important to think about. So speed matters, safety matters. People aren't going to bounce back as well. And you can see here, average risk of death by speed. So the lower the speed, and we're talking about communities, we're not talking about highways here. The lower the speed, the safer it is for people to get around and survive. But we do know once your rate of dying from an impact increases significantly when you hit 45, but that also goes up and more than double once you hit age 75 and older. And the other thing to think about is we think about, sort of the equity and thinking about all different ages as people in life segments. We also look at, where you live matters. So looking at pedestrian deaths by race and ethnicity, again, over a 9-year period of time, 2005 to 2014. And you can see particularly in the African American and Hispanic communities, lower percentage of the population than the percentage of pedestrian deaths. So why is that? I think that's a question we need to ask. How have we built those neighborhoods? Did we do the investments we did in those neighborhoods that we did in other communities? What is that we need to look at? So not only is this about, redoing new roads, but looking at the rehab too, and starting to think about what's causing the accidents, how are people, and why are people, in these neighborhoods and in these communities experience a higher percentage of pedestrian deaths. And again, so we've got now this double-edged sword. We want people to be safe, and we're all telling people, get out into the community, go out and walk, go out and bike. We're trying to cut down on number of crashes. At the same time, we're trying to put more people out on the roads. So it is, it's not a stagnant population here. It also is something to think about, that we're pushing more people out on the road. So it's also important to think about, what is the future going to look in terms like this road, and not just in terms of vehicles. I love this chart. This tells you about, we did a survey last year on, how people get around, and we broke this up by age segment. So you can see, the little yellow arrows, people 65 plus, 88% of the time they say they're driving. And as you can see, and probably would expect as people are getting older, the number of people who are walking is dropping a little bit. The same thing with biking. And the other piece, which is interesting, is rideshare. So we have a lower percentage of people, really 50 plus, who are using rideshare. It's a new technology, something that people may not feel safe with or comfortable with at this time. So how are you, or are you thinking, or is your community thinking about doing anything with rideshare? So, for these people 50 plus, they're sort of rideshare immigrants. This is new for them. This isn't a technology they grew up with, as did the younger population. So there may be some training that's involved. And the same thing we see here with public transit, public transportation, is the number of people, younger are more likely to use public transportation than older adults. So if you're thinking about doing some types of investment in public transportation and say, oh, this will be a great opportunity to provide a service for older adults who may not feel comfortable driving anymore, you'll also have to understand, if you're creating something new like this, you have to bring in tandem the resources to change the culture and really the experience of people to make this a norm for them. So in this realm, this is not something that if you build it, they will come. So again, some things to think about there. And again, overall, survey after survey that ARP's done looking at adults, people want well-maintained, safe, and accessible streets, easy to read traffic signs, is something that's really extremely or very important to them. People want to feel comfortable if they're going to leave their homes. And, again, I just want to reiterate this, 35,000 vehicle-related fatalities in 2015. We need to think about transportation as a system. Our roads are part of that system. Transit is part of that system. Bikes, walking. How are we rethinking even what we did a couple years ago? As technology has changed, I think we're also seeing opportunities for people to engage in their communities change as well. And again, I want to just go through some of the challenges that we need to think about. Again, speed. Speed is very important. Not only for impact, but also for the ability for people to react and to be able to stop. So what are the speeds? Do we necessarily need to move people at the speeds that they're at? Because we know no one goes the speed limit. They all go over. So what's that acceptable speed that you're looking at? Again, a graphic on wider lanes. If on one side of this road we have a senior high rise or a higher number of people who are older living there, how comfortable are they essentially crossing 4+ lanes of traffic on the light? Is there enough time versus looking at creating these medians, these safe spaces in the middle? And again, these long crosswalks, and again, crosswalks to where once you get out of a lot of suburban areas or even in suburban areas, these long crosswalks to get you to a shopping center, and you cross the road and there may not be another sidewalk there. You may just end up in a dirt path that you have to get out in the street. So you're walking with traffic, which might make you more vulnerable. And again, here's a gentleman, he's got his curb cut on one side, and what's he going to on the other side? And can folks see this gentleman as he's crossing the street? And turns on red. It's so automatic. I can turn on red. Are people really paying attention? And what are the types of things that we can do in terms of opportunities? So can we reduce street and lane size? And if you see here, we've got spots for people to cross, we've got spots for people to walk, we've got space for people to ride a bike. And I think that's a number of things, as well as looking at how we're doing parking on the road. Are we having it so people share the space, or are we starting to separate it out a little bit to make it safer for folks? Again, curb extensions, are these the types of things that give people a little bit of safety, give the driver a little bit of visual feedback that, oh, I've got to slow down here because I can see people, I've got these visual cues that are going on. This is what I love. This is a picture from Washington, D.C., just around the corner from ARP offices. There's the all pedestrian crossing. And this is where all vehicles stop, and pedestrians can take full advantage of the intersection at one time. And we see these in LA, we see these in Washington, but I happened to be in Plymouth, Massachusetts not long ago, and ended up doing a tutorial for people who had never experienced one of these before, that in this small community of tourists, they actually found it safer to have an all pedestrian crossing so people could feel comfortable and safe and not have to worry about distracted drivers or people trying to get to their vacation destination. So these are the types of things that work in a variety of settings. Again, staggered timing of traffic lights. So you get the pedestrian to have a little bit more time into the intersection, so then cars and vehicles will see them before they come out. Raised intersections, again, that feeling, that sense, the interaction that, this is a pedestrian area, this is where there's crossing. Starting to see more and more of these around the country, particularly in areas where there is a high pedestrian volume. But again, it slows people down. And the other thing to think about is people say, oh my gosh, you want a traffic calm, you want a traffic calm. In the right spots, traffic calming also helps economic development. People will slow down, they'll see what is there, they'll stop, they'll shop, they'll spend their money, they'll give back into their communities. So there are a lot of positive impacts of traffic calming as well, besides the safety piece of it. And traffic circles, again, these work everywhere from a store plaza to rural roads to urban and suburban settings, depending on the size and what you want to do with these. And again, you have to slow down. And one of the things I want to really talk about is tactical urbanism. I'm hoping people have heard about tactical urbanism at this point in their life. And this is doing a temporary demonstration project to test something out. So all of these things I talked about, the all pedestrian cross, the bringing the curb cuts out, all of these things cost money, but you want to test them first. So is there something you can do over a short period of time to test out? We worked with a group called Team Better Block in Fort Worth, and an area, high pedestrians and a very dangerous intersection, and ended up putting in a short-term traffic circle, which you can see here. People adapted to it very well, And the exciting piece was 3 months later, the city made it permanent. The community liked it, the people who lived there, it was fine, and actually a lot of drivers said they felt safer as well because they weren't sure where people were going to be and turning. So feel free to also take these ideas and test them out and engage the public with these. Make sure that you're listening to them, what's going on in their community. The best person who can tell you about their street is someone who lives there. So again, complete streets, we talk about looking at all users, and I mentioned this earlier. Do we want them to share the space? We want them to compete for the space, or do we want them to each have their own space so they feel safe with this? And again, looking at your setting, urban, rural, and suburban, this plays out differently in different locations, but where you have the space, where you have the opportunity, where you have the interest, look at those shared opportunities within a community. And again, here's a tactical urbanism project we did in Indiana with Team Better Block. And you can see that parking is now essentially in the middle of the street. There is a space for cyclists and walkers. There's another side of parking, and then there's a straight shot down. This is a one-way road that you can see where people are now able to use it in a variety of ways. And they found they really didn't need all that space for this one-way road. They now opened it up, and more of the community is getting involved, out in their community. People can bike, the kids can, rollerblade and do the skateboarding, that type of stuff. And again, looking at road diets, looking at the widths of roads, looking at, here's an opportunity to look at parking opportunities with the spot for the doors to open on the left. People can bike, all well laid out for people to use the road in a variety of different ways. And again, do we have an opportunity for a turn lane in the middle? If you look at a lot of communities, when a lot of our larger roads were developed, 4-lane roads in community, a lot of them were based on workflow, where people were working. Is that still true in your community, or can you come up with some creative opportunities to make the road a little bit more enticing? The other thing to think about when you go through this, I started out talking earlier about, how and why people use their community, thinking about development. And one of the things to really think about, and you'll hear this more in next week's session, is transit-oriented development, is thinking about, are you building in places where people can engage with the community? Are you building in places where people can get around? And again, this benefits not only the community, but individuals as well. There's greater connectivity. You're looking at enhanced public health, transportation and housing choices, higher transit ridership. So try to do this type of planning in tandem. And again, going back, just talking, and want to reiterate about ride sharing is, again, remember, we're seeing the most rideshare users amongst younger adults because they're sort of coming up with this. So it talks a little bit about how people are using rideshare and also the reasons why people are not using rideshare. So if this is something that you're going to be looking at, these are some of the issues that you want to address. And then also if you're looking at older adults in terms of rideshare, can someone who's disabled or use a cane or a walker be able to get in and out of these vehicles as well? And the other thing, which we hadn't even probably thought about, even 10 years ago, is this new technology. We got e-bikes, we got e-scooters, we got trikes out in the community. How do they interact? Particularly when these are e-scooter shares, e-bike share programs, bike share programs. So we're promoting more people to use these services to get around in our cities and in our spaces. But are we incorporating the growth of that into the future of our planning and then, the all-important conversation around highly automated vehicles. What is the future of that, and how does it impact our transportation planning? And one of the things, as we think about this is, I want to make sure folks know that automated vehicles come in different levels. So they're not all the same. There's ones where, you'll get the warning and the driver has control all the way up to the point where you have a passive driver. So people are working on this at different levels, and you can see here some of the corporations who are working on this, and organizations, and the years that they're looking to move forward on this. So it's becoming a reality fairly quick. And then what are your rules and regulations for that? Where is pickup and drop off if someone is, if you're in an urban setting, that someone might order an automated vehicle, to get through. So again, the question is not when will they take over, but how can they support our vision for the future? So you should be having a vision for the future, or at least a question on your on your planner to talk about how does the future of your job and transportation planning and age-friendly streets integrate with this, and what are the things you need to be aware of. The other thing is, if we're going to be looking at having more people biking and active transportation opportunities, are we thinking about putting in things like bike tune-up stations? If we're going to have more walking, are we going to have the benches that are out there so people can, take a break when they need to and feel comfortable and safe? And then also, where do you start? So ARP has a lot of resources available. We have our roadmap to livability, which is our, and right here you can see our transportation workbook to take people through things that they need to think about and create a plan of action. We also have a walk audit toolkit. And this is, again, these are all free and able to download off our website at any time. But our walk audit toolkit also looks at driver behavior, as well as ratings and observations of what's going on in the community on how you think our people's perspectives are. So get some neighbors together from around an area and take them out. Don't just have a public listening where people tell you. Literally go out in the community and explore the roads and have people come out and talk to you about what they're seeing. And I think you'll end up with a product that really matches what they need, plus your knowledge, expertise, and understanding. So you could always feel free to go to the website and download any other materials. So, and that is it for me.
Great. Thank you so much, Bill. I really appreciate all of that, and you raised some really interesting topics that I hope to revisit when we get to our Q&A. For now, however, what I'd like to do is remind everyone that you can continue to submit questions and comments into us to be thinking about the Q&A period that'll happen at the end. I did post the PDF copy of the slides in the handouts area of the GoToWebinar control panel, so I'm hoping you can find that, download that PDF file directly there. You can follow along with the slides, refer back to the ones that Bill just shared, and keep those for your notes. I'm going to be moving the presentation along now to Laurie Beck from CDC, who's going to be sharing some additional information with us on safety and how this all fits together. And so, Laurie, I see your desktop now, and you pull open your presentation. I'll let you know when I see that.
Okay.
Perfect. You're all set.
Set? Okay, great. Thank you. Thanks for the opportunity to speak here today. I am going to be focusing on two types of injuries that older adult pedestrians may face. One of those is falls, and the other is motor vehicle crashes, motor vehicle pedestrian collisions. And just for an overview of what I'll be talking about, I'm going to cover the definition of mobility that CDC has been using in our work. I'll review falls risks for older adults, crash risks for older adult pedestrians, and then I'll talk about two of our products related to older adult mobility. And these are STEADY, which is a fall prevention initiative, and the My Mobility Plan, which addresses transportation and falls. So first, for our purposes, CDC has been defining mobility as being able to safely and reliably go where you want to go, when you want to go there, and how you want to get there. And the Injury Center is interested in this because mobility-related injuries are the leading cause of injury and injury death for older adults. And again, these are falls and motor vehicle crashes. So when it comes to aging, our mobility can decrease due to physical changes with the body, increased chronic conditions, as well as increased medicine use or changes in the way that the body metabolizes medicine. So in other words, a medicine that a person may have taken previously with no issue may cause new side effects as the body is aging, just due to the way that the body is processing those medicines. And decreased mobility can result in declining health and can result in social isolation, which in and of itself has negative health outcomes. So first I want to look at older adult falls. We know that falls are common among older adults. The findings up here are from a study that was published in 2016, and we found that over 1 in 4 older adults, 29% of them, reported falling at least once in 2014. Of those who fell, 38% reported a fall that required a doctor's visit or restricted activity for at least 1 day, and this amounts to 7 million fall injuries. Also in 2014, more than 27,000 older adults died from a fall, and that number has since increased to about 30,000 deaths in 2016. We've also found that older adult fall fatalities have increased over a 10-year period from 2007 to 2016. The death rate in 2007 for older adult fall deaths was 47 per 100,000 population, and this increased to 62 deaths per 100,000 in 2016. This is an average 3% increase in the rate per year over that time period. And so we also know many older adults are afraid of falling. And this fear of falling can have concrete consequences on a person's health and their daily activities. So the fear of falling is associated with reduced life space. Life space is a measure of an individual's mobility patterns and specifically how far they typically go in a given period of time. So for example, in the last 3 days, has an individual left the room where they sleep? And was their activity limited to other rooms in their home? Did they go outside the home? Did they go out into the neighborhood, out around town, or even out of town? And this life space, restricted life space, is something that's associated with the fear of falling. Fear of falling is also associated with declining physical and mental performance, as well as an increased risk of falling itself, which may be due to kind of this reduced activity and reduced kind of fitness and an increase in weakening of the person's physical body. So while falls are common, the good news is that they can be prevented. So I'll talk about the STEADY initiative, which is mentioned here, in a few minutes. But for now, I want to focus on the many modifiable risk factors that can be targeted to reduce the rate and the risk of falls in older adults. So these include poor gait, strength, and balance, which can be addressed with physical therapy or with evidence-based exercise or fall prevention programs. Medications. Some medications increase fall risk, and medication management by a clinician or pharmacist can help with that. Home hazards can increase the likelihood of a fall, and occupational therapists can evaluate home safety and make recommendations. Visual impairments, these can be addressed by the ophthalmologist or optometrist. Orthostatic hypotension, if this is observed, it can be addressed by stopping, switching, or reducing doses of medications that increase fall risk. It can be addressed by hydration, by exercises, or by compression stocking. Feet and footwear issues can increase the likelihood of a fall. This can be addressed with a podiatrist. And also vitamin D deficiency is associated with falls, and that can be addressed with supplementation. So now I want to focus more specifically on older adult pedestrians in terms of pedestrians and motor vehicle collisions. The concern here is that pedestrian fatality rates increase as age increases. The rates that you're seeing here on this slide are based on the number of walking trips that a person makes, and we can see that the fatality rate for older adults, people age 65 and over, is about 30 deaths per 100 million walking trips. And this is about double of those of the death rate for those who are 25 to 64, where the death rate is about 16 deaths per 100,000, or excuse me, per 100 million walking trips. We've also seen an increase in the pedestrian fatality rate over the last 10 years. And in terms of risk factors for pedestrians, I want to mention a few that are specific to older adult pedestrians, and these include older age. And by older age, I'm referring to people ages 75 and over. They have higher death rates than those who are ages 65 to 74. Older adults may have slower walking speeds, and so this affects street crossings and things like that. And also physical frailty or the higher prevalence of chronic disease or disability. And this issue specifically contributes to higher case fatality rates when a crash does occur. I also want to mention risk factors among pedestrians of all ages. And specifically, I want to call out race and ethnicity status. Bill mentioned this a few minutes ago in his talk, but we do see higher pedestrian death rates among Blacks, Hispanics, Asian, Pacific Islanders, as well as American Indian and Alaska Natives relative to whites. And so I think there's a definite need for older adult pedestrians to be considered in just designing interventions. And just one example is adjusting the timing of pedestrian crossing signals that allow sufficient time for older adults to cross a street. And then before I move on, I want to make the point that the population in the U.S. is aging, as we all know. But with the aging population, along with the increasing racial and ethnic diversity among this age group, we can expect continued increases in the number of older adult pedestrian deaths. So this is definitely something that is a continuing issue and something that requires attention. And finally, I can't close any of my talks without referring to some of the tools and products that we've got available at CDC. So I'm going to go over two of those now that relate to older adult mobility. And the first is the STEADY initiative. STEADY stands for Stopping Elderly Accidents, Deaths, and Injuries. This is an evidence-based fall prevention program. Excuse me, it's an initiative. It's not a program per se. Rather, it's an initiative or a framework that's based on clinical guidelines and encourages healthcare providers to screen for falls risk, to assess and identify a patient's modifiable fall risk factors, and to intervene using effective clinical and community strategies. STEADY provides an algorithm for falls prevention, training materials and videos for healthcare providers, along with materials that they can use, that the providers can use to screen their older adult patients. STEADY also provides materials that are directed at older adults, and all of these materials and all of the information is available on the website that's listed at the bottom of this slide. And the other tool that I want to mention is the My Mobility Plan. which was just released in January of this year. It's a planning tool that addresses both transportation and falls. It's designed to help older adults stay mobile and independent as they age. And the My Mobility Plan is a 4-page tool. It takes a positive, healthy perspective toward aging, and it's targeted to older adults who haven't yet thought about or planned for future mobility changes. And so here, ideally, we're really targeting kind of the young old population, kind of 60s, early 70s, who are still, this is a population that's still very active, very independent. A lot of people are working, and they're active and on the go, and they may not have thought ahead to changes that may occur, but we want them to plan for those changes to protect mobility and independence. And so the tool itself, you can see on this slide, this is the cover page of the tool, and inside there are 3 additional pages, and each of them is focused on one of these different areas of mobility. The first is related to, it's the Myself page, and it has health and fitness tips. For example, getting a physical checkup annually. It calls out the importance of reviewing medicines with a doctor or pharmacist, has suggestions for physical activity programs, and things of that nature related to the individual self. The next page is the My Home page, focuses on reducing falls risk at home, such as by removing or taping down area rugs, ensuring proper lighting throughout the home, making sure there are secure handrails on the stairs, and more things of that nature. And finally, we have the My Neighborhood page. I think this is what's most relevant for today's audience. This is a page that addresses how to stay mobile in the community. So it encourages people to think about all the places they want and need to go, and then to plan for how they might get to these places if their mobility changes in the future. As Bill pointed out in his talk, the vast majority of people in the United States, including older adults, are driving to the places that they need to go. And we want them to think about, you know, if and when the day comes that they can't or they choose not to drive, you know, how are they going to get around? They still need to get out and go places. And we want them to be prepared for that eventuality. And so this tool has been evaluated, and it showed that older adults who did use the tool were more likely to take steps that are pointed out in the tool to protect their mobility and independence. So we were really excited about that. And the tool, as well as a number of related materials, are available on the website listed here. And for those who are interested, everything is also available in Spanish. And that wraps up everything that I had to cover today. I'm going to turn it back over to Dan to hand off to our next speaker. Thank you.
Thanks so much, Lori. That was excellent. We're going to finish up our presentations with our next panelist, Dr. Tim Platts-Mills, and then we'll have some time for Q&A. So please continue to send in your questions. I've got some excellent ones now that have been sent to me so far, but we still have plenty of time to gather more. So with that, let me shift attention here to Dr. Tim Platts-Mills from UNC. And Dr. Platts-Mills, you've got some topics you wanted to key in on, and I've got some slides to kind of scroll through as you move through the material.
Great, thanks. Hi, everybody, and thanks for the opportunity to join PBIC and Bill and Lori on this important webinar. I'm a practicing emergency physician in the Department of Emergency Medicine at UNC Chapel Hill, and we run an emergency department for a level 1 trauma center caring for a large population of older adults living in both urban and rural areas. I'm also a clinical researcher and have led several studies examining outcomes after injury in older adults. So the first point that I wanted to make was in regard to advanced age and being a risk factor for worse outcomes. So it is both a risk factor for being hit by a car and also for worse outcomes. And among older adults, mortality rates after being hit by a car exceed 25%. Those who survive often have very long recoveries and high rates of persistent disability. Common injuries that we see in the emergency department include head trauma, chest trauma, and extremity fractures. And unlike in kids who break their arm pretty frequently, when an older adult breaks an arm or another extremity, like has an ankle fracture, the recovery is not a matter of like 4 to 6 weeks. It's much longer than that, and often precipitates a decline in function that leads to death. So these injuries, even the minor injuries that can occur, if a patient is more fortunate, can still have really profound long-term consequences. Next point is trying to think about why older adults have risk factors for fall, for being hit by a car. And Lori did a nice job of describing risk factors for falls. Those factors that she described are also factors that place older adults at risk for being hit by a car. So the fact that they are walking slower when they're crossing a street, it takes more time, so they're more time sort of exposed to that dangerous environment. Chronic disease, impaired vision and hearing, which makes identification of a moving car a little bit more difficult. And then also they're less agile, and so if they do see something coming, they're less able to move out of the way. So those are some of the factors that put older adults at risk and sort of need to inform the building of building safe streets. There was an additional point I wanted to make, which is separate, which is the physician perspective on mobility in older adults. And to put it simply, older adults must keep moving to live. So large-scale studies show that physical activity in older adults has a strong positive effect on physical function, which is not that surprising. If you move your body, you're able to move your body, but also has a strong positive effect on cognition and long-term survival. And consistent with this, so if you measure a gait speed in an older adult, it is one of the single strongest determinants of survival. And so it's actually a better predictor of mortality than whether or not a person has cancer. So if you see an older adult and you see how fast they walk, and if you are an older adult, if you have older parents, you can look at this, and hopefully it's not too disappointing to you what you find. But if you look at gait speed, that is going to predict how well they're going to do over the next 5 years. The best way to preserve gait speed is to keep walking. So I would take the position, and many others have, that walking is the most important health behavior in older adults. So it is sort of imperative on us as we have this growing population of older adults to keep older adults walking, and how do we do that? And obviously the place in which we walk is very, very important. There's another part to the walking, which is that as you know, driving can eventually become dangerous in older adults. And some older adults either lose their driving privileges or self-regulate their driving. And so as a consequence, walking is not just an essential health behavior, but it's also a means of retaining independence and engagement in the community. And so for these reasons, ensuring a safe walking environment for older adults is tremendously important. The final point I would make was touched on already by Bill and Lori, but there are issues related to sort of socioeconomic status and social justice in a lot of this work. So socioeconomic disparities in the lived environment mean that older adults who are wealthy and have financial resources or living in wealthier communities often do have safe environments to walk and have alternative means of transportation. And those who do not have financial resources have much more restrictive environments. And as we've already described, that's going to have consequences for health. Bill sort of showed this in some of the data he showed on death rates being higher among Blacks and Hispanics relative to their representation of the population, deaths from being hit by a car. And and some of those differences are almost certainly linked to the characteristics of the built environment. So I think part of the challenge for all of us going forward is to figure out how to ensure that the environments are safe, not just for one group of people, but for everybody. That wraps up my comments. Thanks very much, Dan.
Thank you so much, Dr. Platts-Mills. I think that's really interesting as we shift here into a discussion period to really think about the medical perspective, the medical community's perspective on this, not one that we often get to feature here on PBIC webinars. And so I'm grateful that you're able to spend some time talking with us about those observations that you've had. I want to encourage you all to continue to send some questions in. I've got some contact information for our panelists here in case you want to reach out directly. They could probably speak directly to you about a lot of the issues that they've covered. But I wanted to jump from where we've just left things, specifically that point about disparities, wealth or income disparities and economic disparities, and maybe those contributing to some of the outcomes we're seeing. because I can, in my mind, connect that with similar disparities that we see in terms of urban versus rural settings. And a lot of the folks on the line are working in rural communities where the idea of aging in place with the vast distances that there may be between a person's home in a rural community and their nearest hospital or healthcare provider or essential service may be much greater than it is in an urban setting. And so I wanted to ask the entire panel if your work has touched on any of these issues related to older adult mobility as it relates to rural communities and what rural communities could be doing to help keep older adults active when they may not have ready access to sidewalks or the proximity of services that make it realistic to walk and take transit and bike to their destination. So would anyone like to weigh in on the on issues particular to rural communities with respect to aging?
Yeah, this is Bill. Let me just start with a couple of things. Designing a street in a rural community is significantly different. I actually live in upstate New York, and not far from me, a complete street out in the country is having enough room for an Amish buggy to be on the side of the road and have their own space versus sharing that with vehicles to avoid accidents. But you do also run the risk of isolation with older adults out in the country, particularly given the distance between where people need to go to shop or to get to a doctor. They may have to go several towns over. And I think this is where the creativity, particularly looking at the network of age-friendly communities and other work that I've done, where people help solve the issue, where you're looking at volunteer driver programs. Up in Maine, they have volunteers who will go deliver sand buckets to people's homes so they're not at risk of fall in the winter, on their stoops or in their driveways to help with things like that. So I think when you're looking at rural communities, you also have an issue of trust. Just bringing someone to someone's home is not necessarily the best way to do it, but to really set up an opportunity to listen to folks, help them come up with the solutions, and then absolutely, integrate those solutions. So it's not just government planning on this, you're also bringing the community into this and creating buy-in, also looking at intergenerational opportunities to engage folks. So just a couple of thoughts.
Any other thoughts about that rural-urban divide or paradigm when it comes to older adult mobility?
This is Lori, and I know that this is a project that we are working on right now and actually are scheduled to begin data collection next month. So I don't really have answers at the moment, but I just wanted to share that we are looking at, we're doing some qualitative data collection around older adults and their perceptions of rideshare programs. And one of the focuses of interest for us is rural populations and, how available are these programs in the rural setting, which I think they're not very common. They're starting to spread a little bit. So that's one of the things that we're looking at. And then just in terms of whether it's rural or not, in terms of rideshare, we're interested in sort of what are the concerns that older adults might have in using ride shares and what are the barriers, that we can overcome and address in terms of assisting them and getting around in their community.
Very good.
Dan, I might just add an epidemiologic point, which is here in North Carolina, which is perhaps representative for other parts of the country. I know my colleagues who work in the emergency department in Chapel Hill, we think we see a lot of older adults, and we do. We see about 15 to 20% of our patients are age 65 or older. But it turns out, if you look across the state, that emergency departments in rural areas see actually even much higher percentages of older adults. And basically, the reason for that is that there is essentially urban flight. I don't know if flight's the right word, but basically young people end up going to urban areas to work. So if you live in rural North Carolina and you're young, you end up in Charlotte or you end up in Winston-Salem or the Triangle. And the the more rural communities have very high numbers of older adults, and so I do think it's really important as people go forward and trying to solve these problems that they focus. They need to consider the rural population, because it's a large number of older adults living in those communities.
Absolutely, yeah, great point. I wanted to bring back to Lori a question for you about the trips and falls issue. I mean, the way you describe, and all the panelists really describing the injuries that might be sustained through trips and falls is a really compelling point. But we don't, as far as I'm aware, in our regular crash data that we get in the transportation world, that we really do use for prioritizing where safety investments go, those trips and falls are not going to be captured in a lot of the data we use to, say, prioritize sidewalk improvement, sidewalk maintenance and quality, improving the quality of our network. Yet that's that's where it sounds like many of these falls could lead to quite severe injuries and negative outcomes for older adults. So I guess what I wanted to ask you, Lori, is that an area of improvement that we could target for the data that we're using to make decisions? If we're missing all of these events, is there an opportunity to expand our crash data systems to capture some of these missed events that are leading to such bad injury outcomes?
Yeah, that's a great question. So yes, the transportation, the traffic crash reports that we look at so frequently aren't going to be picking up these kind of falls on sidewalks or falls even in the roadway if it doesn't involve a motor vehicle. So yeah, we really don't know the extent of that. We do have comprehensive falls data in, medical databases and hospital records and things like that, but how we suss out which ones occurred sort of in a transportation setting versus which ones occurred in other places, I'm not sure, but I think that it's important to consider. Tim you might have a better understanding, since you work in the hospital setting, of how to classify, the setting where the fall occurred.
Yeah, that's a great question. There are a couple of the databases that come to mind. One is the NAMCIS, which is the National Hospitallatory Ambulatory Medical Care Survey that happens annually. There's also the Nationwide Emergency Department Sample. I think NAMCIS probably has more data on where that fall occurs. Some of these data sets are just giving you chief complaint, which might not tell you the location of the fall, whether it's like in a home or out on the street, which could be important here. And then also within North Carolina, there's something called NC Detect, which has also chief complaint-based data for the entire state. A lot of those data sets may fall short of the level of detail that you'd want, and so certainly within a healthcare system, you might be able to get more detailed data that would allow you to sort of extract information about location of fall.
Yeah, and I wonder, it makes me think that, if we've got, and I know we do, a lot of the folks on the line are representing transportation planning and engineering public works departments who are making improvements to the built environment and making safety improvements. And I wonder if it's an idea to think about which agencies and which organizations might be the best ones in their communities to partner with or to try to build more relationships with, to really get the older adult mobility and safety angle built into their programs if it's not incorporated already. And I wanted to ask our panelists, and I actually wanted to ask everybody in the webinar as well, to send in, using the questions pod, recommendations for agencies or organizations in your communities that might be good sources of this information, and those partnerships just might not exist yet. And I wanted to ask our panel the same question. And Bill, your organization, AARP, I've only recently, within the last couple of years, learned that you're really developing a lot of local partnerships and networks around the country. And I wonder if that would be an organization that a transportation agency should seek out. Who is AARP in my community? Is there a good way for them to go about doing that?
Yeah, I think one of the best ways is to, go online and click your state, arp.org, and you can click whatever state you're in, and that'll help you connect with state staff. And we also have a list online of all the communities that are enrolled in the network of age-friendly states and communities. So we could also help connect you with those communities as well to ensure that there's really comprehensive dialogue on this. I mean, when you bring a lot of transportation planners may not be connected into aging service providers and vice versa. So bringing those groups together can really help do a lot of problem solving, whether it be your council on aging, your area agency on aging, your office for aging. If you're not connecting with them, it's well worth a lunch, just to sit down and talk about what they're seeing or what they would like from a planning perspective. I remember working with a group of planners and in a community, there was a lot of out-migration of manufacturing, and they were like, we've had this history of planning by tornado. Nowadays, we get so excited somebody wants to build something, we all just run around and it drops where it is, and we want to change that. We want to be a little bit more planned, and we want to think about the traffic patterns and look at the options. So I think there's opportunity for control there. I think also, looking at zoning opportunities, there's a lot of things we've had on the book for decades that can keep us from doing things. So be aware of what you may wish or have to do to, even change some of the policies that you have in place already.
Those are some great recommendations, and I'm told by some folks in the chat pod that silver sneakers or silver and fit programs are really good opportunities to find and get older adults engaged in transportation decisions if you're looking to do some outreach. But Laurie and Tim, do you have recommendations for other kind of typical groups that might help, that people could reach out to in their communities to get this perspective? Anything that Bill left off?
Well, I know that most state health departments are doing work in the injury and violence prevention area, and not all of them, but a good number of them actually focus on motor vehicle transportation safety. So if you haven't, I would suggest reaching out to state health departments. I know that CDC funds about half of the states currently to run injury prevention programs out of their health departments. And I don't know which ones on the top of my head, but they're listed on our website. So that's a good place to start in terms of connecting with health partners.
This is Bill. I just want to add in a couple more. There's a national group called America Walks, and their whole promotion is active transportation, getting out walking, and they have initiatives going on around the country. So they're well worth a connect, and particularly if you're in other, non-urban communities, look for Main Street America. This is folks that are really dedicated towards the revitalization of downtowns, Main Street areas, and particularly small and mid-sized communities. And I think they're a good partner to bring in as well. And they can talk a little bit about what's going on with traffic patterns and what they're seeing, in their own communities.
Right. And Dr. Platts-Mills, it sounds too like if your community has a trauma center or hospital, there's good chances that those folks might be provide the pieces of information about these high-risk fall locations or what they're hearing about where these injuries are happening. So it might be worthwhile to make contact there, I guess.
Yeah, Dan, and I would just add that the CDC, since I guess 1987, has funded injury control research centers, and there are at least 10 of them nationally. UNC is fortunate to be one of those centers, and that's a great resource for people in North Carolina. But they're also, if you look online at the CDC website, you can see where the other centers are, and they're fairly sort of broadly distributed across the country, and they will have a lot of expertise about some of these issues. So.
That's great. Thank you very much for that. Dr. Platts-Mills, another question to follow up on a point you made earlier. You're talking about various risk factors for crash involvement for older adults, and mentioned a few things. Bill talked about speed and a few other factors. There's a few questions about visibility and particular like nighttime, dark conditions being we know that that's a risk factor for pedestrian crashes in general, and I wonder if that's a more pronounced risk factor for older adults and what you've seen. Is that one where older adults are maybe especially vulnerable at night, and lighting could be a consideration for improving their safety as well?
Yeah, that's a great question. I think they're kind of like you kind of can break that into two pieces. One is can the driver see the older adults? And there's nothing inherently in being old that makes you invisible, but if you're wearing sort of like drab colored clothes, then perhaps. And which sort of then gets to this question of what's the culture. This is really a big issue in biking. Is what's the culture around wearing clothing that has reflective clothing or bright clothing, or like a neon, let's say a neon yellow shirt or something, when you're walking around town. Now, that some people accept that and some people don't. I don't think most older adults, when they walk outside to go across the street, they don't throw on a big reflective shirt, but arguably they should. And you can imagine some stigma around that and reasons why they might not want to. The other issue is, are older adults able to see what's coming at them and or interpret correctly, let's say a crossing sign, or make a correct judgments about how far away a car is or how fast it's coming. And my guess is that older adults don't do so, some older adults don't do so well with all of those things. And so obviously making the street fundamentally safer is a great solution, but there may be some other solutions related to education through primary care providers or through senior centers regarding like, hey, now that you're older and you don't see as well, you need to think about these things. I mean, you could imagine various levels of intervention for that problem. But I think there are potentially issues on both of those points. Lori may have some further thoughts on that.
I know, related to that, a lot of, well, not a lot, but some older adults who feel uncomfortable driving at night because of vision concerns. I don't have the answer, but it's possible that they would also be less likely to go out at night walking. It's something that hasn't been looked at specifically, but we do have the data in terms of older drivers and self-restriction. So it would be interesting to think about older pedestrians and similar behaviors that they're taking to sort of compensate for things that they're uncomfortable doing.
Mm-hmm. Yeah, absolutely. That's a good point. Laurie, to keep it with you for a moment, quite a few questions about not only sidewalk quality itself and maybe that becoming a tripping hazard, but winter weather conditions. And we know it's a struggle in many communities to get either the transportation agency or the property owners to properly clear snow and ice from sidewalks. And, if you're able-bodied, I'm sure you can in some ways traverse these sidewalks, but that's got to be, I'm speculating that snow and ice is a particular hazard when it comes to trips and falls, and might even keep people from walking around at all to begin with. So I wonder if your work has looked at winter weather and its effects on trip and fall hazards.
We haven't looked at that, but I suspect that it's out there, that the data are out there. I just don't have an answer.
Okay, no problem. Yeah. Any other thoughts, Bill? I don't know if you all have looked at sidewalk maintenance with respect to clearing snow and ice from sidewalks.
Well, living in an area that gets an average of 10 feet of snow a year, we do go through that where we don't see our neighbors for a couple of months. We do find a lot of people just sort of self-isolate. They just go out when they need, or get out. But it may not impact the fall because they're, you know, maybe less likely to go out, but it may impact their health from not being able to go out. So either way, it becomes detrimental for folks. And then again, this is an opportunity, particularly in smaller communities, to identify who those people are and set up like local neighborhood programs or volunteer programs where you have someone who will, you know, help clear the sidewalk. And you know, sidewalks in neighborhoods, once you get off of Main Street, are a big issue. You know, it's a, you know, if you're on a main street, the municipality owns the sidewalk. If you're, you know, in a neighborhood, are you who's responsible for the upkeep of it? Is it you? Is it the municipality? Whether it be snow removal, whether it be cracks or heaving, you know, and looking at older adults, this is something we need to look at too, particularly people who may be on fixed incomes, whether they're able to financially deal with the upkeep of those sidewalks as well. You know, sidewalks are great because you can get out and walk. But again, if there's areas in your community or your neighborhood where the sidewalks are in disrepair, then again, they become you know, trip and fall hazards and may limit people to go out because they don't even feel safe. The only place they would have to walk would be in the streets.
We've spent quite a lot of time, primarily focused here on older pedestrians, but for improving conditions for older bicyclists, we can expect that if an older person, I'm going to speculate again, older person is able to ride a bicycle, perhaps an electric assisted bicycle to give them a little extra power, they're able to use many of the same bicycle facilities, the separated bike lanes possibly, the shared lanes in certain conditions that other bicyclists are using. But what in particular should we be keeping in mind? I guess, Bill, starting with you again, we're designing bicycle facilities for older adults. Do we know much about older bicyclist preferences within a subset of bicyclists on the road? Do they have strong preferences for certain types of facilities, or is it, again, this approach of designing for all ages and abilities and making sure that we're giving separation where the speeds and volumes are highest? Are there any good rules of thumb that we can be keeping in mind?
So I think some of the things to think about is, who are the bicyclists? Are these people who have biked their entire life, or are they people who have picked this up later in life? You know, typically the majority of people are people who have cycled throughout their lives or picked it up in their younger adulthood. So again, understanding that, I think someone who has biked their entire life does have that confidence and that comfort level to go out and do the shared space and the bike lanes, having opportunities for people to learn. I think there's always opportunities for education on both ends, both for drivers, but also, you know, you talk to any driver and they will tell you about a bicycler who was on the wrong side of the road or just crossed the street on red, you know. So, you know, getting that mutual respect, I think culturally we have a long way to go towards sharing the road, because this is sort of, you know, on the grand scheme of things, fairly new in terms of setting up these distinct spaces for folks. So I don't know if we have enough information about specifically older adults, but I think you want to make sure that you have this set up that people can have the comfort and the confidence to be able to ride safely. So I think safety is the big thing. And then again, are they competing for space or are they sharing space?
Sure. Yeah. I wonder, Dr. Platts-Mills, you mentioned some characteristics of older adult injuries that you've seen, and I wonder if this tends to older adult injuries when riding bicycles. Is this a separate issue from a sort of an injury perspective, or are there any particular concerns that would that seem to jump out in terms of the literature and the things that you've seen?
Yeah, thanks, Dan. I'm a lifelong biker and bike commuter, so I'm integrating that information as well into this response. I'll say you probably see a little less lower extremity and pelvis injuries after a bike accident, and a little more upper extremity because you're sort of catching yourself, or clavicle fractures, and then you see head and neck injuries. And the older adults that we see who are riding bikes who get hit, generally they are sort of like pretty fit and they are cognitively very high functioning, but they're nonetheless, their bones aren't as strong as perhaps a younger person, and also they will have long recoveries. But fortunately, if they're healthy, they can do okay. Obviously, the goal is to avoid the trauma. The one thing I would add two things. One, these e-bikes that are coming out now that people are using, those things are pretty peppy. They're not just like a bicycle. They're like a cross between a bike and a motorbike, and they can move pretty quickly. And so I think it's good for us to be aware that some of those people can go pretty fast. I think, most bikers aren't going to go much faster than 20 miles an hour, and uphill or on the flat, they're going to go 10 or 15 miles an hour. And these bikes can bump things up quite a bit, which does raise the stakes a little bit. Of course, it's fun to have a motor behind you, but raises the stakes a little bit. The other thing that I think is really important for planning is that most bikers don't want to have anything to do with a sidewalk. The ideal for a biker is to be riding on the road next to cars, but have your own space. And maybe I'm going to assume that all bikers feel the way I do, but I really think this is the way bikers want to travel. Is they don't want to get in and off of the sidewalk, because then inevitably you have to reintegrate with the road and then back with the sidewalk. And so I think the ideal is to have a road that has a protected biking lane that is really well protected. So that's my sense of the ideal. Bill and Lori, you guys may have another perspective on that, but I think it's okay to sort of have pedestrian bike spaces, but travel lanes that are both mixed pedestrian and bikers are not necessarily great in terms of safety either. So I just want to make that point, or at least provide that perspective.
Yeah, a very good point. And we certainly know that different bicyclists have different preferences, but I remember discussing this with you all just the other day, and bridging it back to this idea of sidewalk hazards and the fear of a fall on a sidewalk. And we often look at bicycle riding on sidewalks as sort of a symptom that maybe we haven't provided the right bike facility on the road. But I wanted to ask, Lauria, bicycling on the sidewalk must play into the sort of perceived fear an older person may have if they're sharing space on the sidewalk with bicyclists riding at higher speeds. I wonder if that can contribute to this fear that they may have of falling, or I wonder if the same can be said for a shared use path where, again, pedestrians, bicyclists, we're sharing the same space, but if it's a narrow path and there are bicyclists whipping around, possibly not maybe the most comfortable environment for an older person. We don't always put ourselves in the position of the older person when we design these things, but I wonder if you have thoughts about that, and maybe that's a case to be made for incorporating that into those facility designs.
Yeah, I think it certainly could be a factor in terms of older adults being afraid of the bicycle that's moving quickly on the sidewalk. I think it was a great point that Tim just mentioned about the reflection of, if we see bicycles on the sidewalk, what is that saying about our general approach to the bike infrastructure in the community? Because I know, at least in my community, it's illegal for the bikes to be on the sidewalk. So I don't know if that's a common feature or not, since I don't work often in the bicycle arena. But yeah, it's certainly not an ideal situation to have these fast-moving bikes on sidewalks with older adults, or really any adults. And just as a side note, the e-scooters that we're starting to see, these shared e-scooter companies that are coming into different communities, a lot of those scooters are on the sidewalks, and I think that's an issue that we need to be keeping an eye on as well.
I wanted to maybe Bill finish and ask if Laura just brought up the new e-scooters we're seeing on the sidewalks. We're also seeing a growth in dockless bike share, and this all kind of contributes to increased demand on the sidewalk space where these things are parked, where people are also walking. And I wonder if ARP is doing any work on the sort of emerging micromobility trends and how those might align with the needs of older adults. You talked about some of this in your presentation, and I wonder if you could say any more about the work you all are doing in this area. It's certainly a hot topic right now.
Well, this does go back to what I was talking about is, we need to plan for the future, but the future's changing as it's, as we're thinking about it. We went from bike share to e-bike share to scooter share, all within a couple of years. So we're still planning for, dealing with the bike share. So I think one of the struggles right now is planning for technology that is growing so quickly, it's hard to anticipate. And this is where we do have to look at those spaces within the community. So, everyone has their component of the road. And again, this is different whether you're in a, rural suburban area versus an urban setting, but really thinking about how that's occurring. And I do know in some transportation planning groups, particularly those who are funders of transportation projects, that they are asking or giving higher points for plans that are submitted with complete streets in mind, that they really can officially look at different segments of people and show how the road is going to be used and the safest way it's going to be used. And again, never underestimate the power of going out and to talking to people in those neighborhoods and bringing in the bike coalitions. Philadelphia is working on Vision Zero, and one of the biggest proponents and leaders in this is the Philadelphia Bike Coalition. So bring in those partners, those non-traditional or non-governmental partners to help be part of the solution and provide that input as well.
That's great, and that's a good place to leave it. I appreciate that response, Bill, and Laurie and Dr. Platz-Mills, all your comments. This discussion period has been really valuable, and I hope we've managed to answer a lot of the questions out there. I know we didn't get to them all, so please consider reaching out to us further for answers to your questions. If we can provide more information, we'll be glad to do that. We are compiling all of our archived material, the slide presentation, the video recording. It's all going to be posted on our website, pedbicinfo.org/webinar, so you can find it there, share it with others who weren't able to attend. And please consider signing up for next week's webinar. We're going to continue this conversation, but shift into a conversation about, well, what are some of these strategies we can use to improve the transportation system, specifically with older adults in mind? How can we talk about housing and housing affordability, transit-oriented development as a way to keep people, give people opportunities to age in place and access key destinations? And what are the signal and roadway design and crossing design treatments we can use that really do speak to the needs and meet the needs of older adults? And so we'll get into that next week. Next Monday, we'll continue. I want to mention to everyone that as you leave the webinar today, you're going to be greeted with a brief survey. We'd appreciate your comments and your thoughts about the webinar today, ideas about what we could talk about in the future. And be on the lookout. Later today, in about an hour, you'll get an email from me with all the material we've covered, links to more information and things like that. But I just want to say thank you again to our panelists, Bill Armbruster, Laurie Beck, and Dr. Tim Platz-Mills, for joining us today and sharing your expertise. And thanks to all of you for attending today's PBIC webinar. I hope you have a wonderful day, and we'll see you next time. Thank you.